Causes and risk factors of borderline personality disorder, BPD, environmental and familial factors. While genetic and biological factors play a significant role in the development of borderline personality disorder, BPD, environmental and familial factors are equally important in shaping the onset and progression of the disorder. Early experiences, family dynamics, and environmental stressors can all contribute to the development of BPD symptoms. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore how environmental influences, particularly family dynamics and early life experiences, contribute to the risk of developing BPD. Understanding these factors can help illuminate the complex nature of the disorder and offer insight into the treatment and prevention of BPD. The role of family dynamics in the development of BPD. Family dynamics, the patterns of interaction, communication, and emotional responses within a family, are crucial in shaping an individual's emotional and psychological development. Children who grow up in families with dysfunctional communication patterns, emotional neglect, overprotection, or abuse are more likely to develop BPD or exhibit traits associated with the disorder. 1. Inconsistent caregiving and emotional support. One of the most significant familial factors that contribute to the development of BPD is inconsistent caregiving. Children who experience unpredictability in how their caregivers respond to their emotional needs may develop difficulty trusting others and regulating their own emotions. For example, if a parent is sometimes nurturing but at other times distant or punitive, the child may struggle to develop a stable emotional foundation. This inconsistency can contribute to the intense fear of abandonment that is often seen in BPD. Children who receive inconsistent emotional support may constantly seek reassurance, validation, and stability from others, but they may be unable to form healthy, stable relationships due to the conflicting emotional experiences they've had in their early years. 2. Invalidation and emotional neglect. Emotional invalidation, where a child's feelings, experiences, or perceptions are dismissed, belittled, or ignored, has been identified as a key environmental factor in the development of BPD. If children are repeatedly told that their emotions are wrong, inappropriate, or too intense, they may grow up with a distorted sense of their own emotional experiences. They may struggle to understand and regulate their emotions, leading to emotional dysregulation in adulthood. Emotional neglect, where a child's emotional needs are not met, even if their physical needs are met, can have similarly devastating effects. Children who are emotionally neglected may feel unseen, unimportant, or unworthy of love, contributing to a fragile self-image and chronic feelings of emptiness, both of which are central features of BPD. 3. Overattachment or enmeshment. Some individuals with BPD come from families where there's overattachment or enmeshment, a situation where family members are excessively involved in each other's lives, often blurring boundaries between the parent and the child. In such families, children may feel that they are overly responsible for their parents' emotional well-being or that they are unable to separate their own identity from that of their parents. Enmeshed relationships can result in difficulty developing a stable sense of self, a key characteristic of BPD. Children raised in these environments often struggle with independence and self-differentiation, leading to an unstable self-image and difficulty in establishing healthy boundaries in adulthood. 4. Exposure to family conflict or dysfunction. Growing up in a family where there is chronic conflict, violence, or substance abuse can also contribute to the development of BPD. Children in these environments are often exposed to high levels of stress, which can disrupt their emotional development. These children may learn maladaptive coping mechanisms, such as dissociation, impulsivity, or emotional outbursts, in an attempt to deal with the turmoil around them. Chronic conflict between parents, or between a parent and child, can increase feelings of emotional instability and unpredictability, both of which are central to BPD. Children who grow up in this kind of environment may develop the perception that relationships are inherently volatile, and this can carry over into adulthood, contributing to the unstable relationships often seen in BPD. Environmental factors and childhood trauma. In addition to family dynamics, a range of environmental factors and early life stressors contribute to the development of BPD. These factors can have a profound impact on emotional regulation, self-image, and interpersonal skills. Some of the most significant environmental factors include 1. Early childhood trauma and abuse. Childhood trauma, including physical, sexual, and emotional abuse, as well as neglect, is strongly linked to the development of BPD. Children who experience these forms of trauma may develop difficulties in emotional regulation, attachment, and self-esteem, all of which are hallmarks of BPD. Early trauma can lead to a heightened fear of abandonment, as children learn that the world can be a dangerous and unsafe place. Trauma survivors often struggle with emotional flashbacks and hypervigilance, both of which can exacerbate the emotional instability seen in BPD. 2. Attachment issues. Attachment theory suggests that early experiences with caregivers shape a child's ability to form healthy relationships in adulthood. Children who experience insecure attachment, for example, avoidant, ambivalent, or disorganized attachment, are at a higher risk of developing BPD. Insecure attachment often results from neglect, abuse, or inconsistent caregiving, and it can lead to problems with trust, intimacy, and self-worth in later life. For individuals with BPD, attachment issues often manifest as clinginess, idealization, and devaluation of others. These patterns are an attempt to cope with deep-seated fears of being abandoned or rejected, which are rooted in early attachment experiences. 3. Lack of emotional support and validation. A lack of emotional support during critical developmental years can also be a significant environmental factor in the development of BPD. Children who are not encouraged to express their emotions in healthy ways or who are told their emotions are invalid may develop distorted emotional responses. This lack of emotional validation can result in chronic feelings of emptiness and emotional instability, which are common symptoms of BPD. In a family where emotional expression is not accepted, a child may learn to suppress their emotions or engage in unhealthy emotional coping strategies, such as impulsivity or self-harm, as a way of expressing emotional distress. The interaction between genetics and environment. While environmental factors, such as childhood trauma and family dynamics, play a significant role in the development of BPD, it's important to understand that these factors don't operate in isolation. The interaction between genetic predisposition and environmental stressors is key to the onset and progression of BPD. 1. Genetic vulnerability and environmental stress. Some individuals may be genetically predisposed to emotional sensitivity, impulsivity, and difficulties in emotional regulation. When these genetic traits are combined with early life trauma or unpredictable family environments, the likelihood of developing BPD increases. This interaction between nature and nurture helps explain why some people develop BPD while others, despite experiencing similar environmental stressors, do not. 2. Resilience factors. While childhood trauma and dysfunctional family environments are significant risk factors for BPD, some individuals may develop resilience due to positive interventions or relationships with supportive figures outside the family. Resilient individuals may be better able to regulate their emotions and develop healthy coping strategies, even in the face of adversity. This highlights the importance of supportive relationships and protective factors in buffering the negative effects of early life trauma. Conclusion. Environmental and familial factors play a critical role in the development of borderline personality disorder, BPD. Dysfunctional family dynamics, childhood trauma, emotional neglect, and unstable caregiving can significantly impact emotional regulation, self-image, and relationship patterns. These environmental factors interact with genetic predisposition to increase the risk of developing BPD. By understanding the role of early life experiences and familial influences in the development of BPD, we can better address the root causes of the disorder and improve treatment approaches. Therapeutic interventions that focus on trauma recovery, emotion regulation, and attachment healing can help individuals with BPD develop healthier coping mechanisms and build more stable relationships. In future episodes, we will explore how therapy, particularly dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, can help individuals with BPD address these underlying environmental and familial influences. Stay tuned as we continue to explore the causes, treatment, and management of borderline personality disorder.